Good evening. My name is Missy.
Hi,
I'm a
Missy.
student at CMCC, and I'll be doing your mock intake session interview.
Okay.
Okay. Um, is it okay with you that we videotape?
Yes.
Great. And I want to let you know that anytime it can be stopped. I also want to touch base with you about confidentiality and its limits. Everything we talk about will be held strictly confidential. There are a few exceptions to that rule, and that is if I feel the need for your safety or the safety of others.
Okay.
If this happens, I'll be obligated to take steps for your safety
Okay.
and others. And there is another exception, and that is for billing, and if it's court ordered, if the information is court ordered. Okay. And at the least of any case, I will give very little information, the least amount.
All right.
Okay. Do you have any questions about this?
No.
All right. So today we're going to be doing your initial assessment, and I want to apologize ahead of time. I will be needing to use my laptop for my notes. The assessment is just to help me get to know you better. And again, I will be asking a lot of questions. And the questions will be about background, family history, some issues you may be having. We'll be looking at education, your occupational history. I'll be just trying to get to know you better. That's the purpose of the information gathering.
Okay, great.
And I want to let you know that there is no right or wrong answer. I want you to be honest, and the information is confidential.
Okay.
So keep that in mind. And also, if you need to stop at any time, if you'd like to get a drink, need to stretch your legs, just feel free. Just take a break because it is a lot of information.
Okay.
Okay. And we can go, if you're uncomfortable with any of the questions, we can go back to them at a later time. If you just don't feel comfortable answering at this time. Okay, so let's get started.
All right.
All right. Again, remember, there's a lot of questions.
That's okay. I have a lot of time. It's all right.
Great. And feel free to get up. It's not a problem. Take a breath.
Okay.
All right, so we're going to start with your name.
Michelle Smith.
Okay. And your date of birth.
June 27th, 1968.
1968. Okay. And your home phone number.
207 779 9031.
Okay. So would it be okay to leave messages on this phone number?
Sure.
Text?
Yeah.
That's all okay?
Yes.
Okay.
That's fine.
And do you have a work number?
207 897 1011.
Okay. And is it okay to leave messages on your work phone number or
No,
text?
I'd rather you
Okay.
didn't.
All right. And do you have a cell phone number?
Sure. 491, or it's 207 491 9030.
Okay. And is it okay to leave messages?
Yes.
Okay. And text messages?
Yes.
How about an email address?
Oh boy. Smith at gmail.com.
And is it okay to email you?
Yes, sure.
How about a your mailing address?
It is 388 Smith Lane in Farmington.
Okay, and is that also your physical address?
Yes.
Insurance company.
Anthem. I have Anthem through my work.
Emergency contact information.
You could call my son. His name is James. And his phone number. Do you need his phone number?
What is his last name then? Smith?
Yes.
And he's your son?
Mm-hmm.
Yes. Emergency contact number.
207 491 9966.
Okay. Who were you referred to? Referred from, I should say. Excuse me.
My general practitioner
Okay.
suggested that I come and see.
Okay.
Yeah.
And can you give me her name?
Sure. Her name is, let me think. I think her first name is Melissa. Hilton is the last name.
Okay. And may we thank them for the referral?
Sure.
Okay. And do you have their address? Address and phone number.
Oh gosh. I think they're at Franklin Health Commons in Farmington, Maine, obviously. And I think let me look up, I'll look up their phone number.
Okay.
But it's, it's 207 330 9405.
Okay. And are you being seen by a psychiatrist?
Not currently.
Not currently.
No.
Okay, thank you. And do you have any community support agencies that you are seeing?
Oh, no. Do you mean
No.
like a case manager or any agency that
Yeah.
we're working with? No, not at this time.
All right. That's it for those questions for
Okay.
now. If you need to take a deep breath or a break, we can take one.
No, I'm okay. Let's keep
Good.
going.
All right. So, what brings you here today? Like in just one brief sentence?
Okay. So I asked for the referral because I'm number one, I'm having some trouble just with anxiety in general. And I would also like to learn some skills about how to deal with my mother as she goes through her own mental health crisis.
Well, I'm sorry to hear that. This sounds like it's been very challenging for you, but I'll be glad to help you. You know, it might take more than one session.
Yeah, that's fine.
But I'm glad you're here today.
Yeah, I'm glad I'm here today.
Is there any way you can identify your anxiety level? 1 being very low, and 10 being high, and is it affecting your daily life, your daily activities?
Yes. So I guess I would say I'm able to get through my daily activities. That's fine. But when I do have to I'm always on guard, and I would say it's probably around a 7 or 8 when I do deal with certain family members.
Okay, so dealing with certain family members
elevates the stress.
has increased. Yes. Okay. Okay. I'd like to ask you some questions about goals.
Okay.
What would you like to achieve from your sessions?
So the first thing I would like to achieve is just to be able to manage my stress better
Yes.
and what to do when I feel that I'm, I cannot handle my being anxious anymore. So that's one goal. And another goal is how to deal with people in a very calm, rational way when they maybe are being irrational.
Okay. So it sounds like you'd like to start with some goals on dealing with your own anxiety and
Yes.
also dealing with other people.
Yes. Yeah. Because if I can get a hold of my own anxiety, I think that I might be more effective to deal with other people.
So maybe some coping skills.
Yes.
Okay, that's great. Are you motivated to come to weekly sessions?
Yes.
Great, excellent. That will make things easier on both of us. Motivation.
Yes.
Okay, I have a couple techniques I would like to try with you before our next appointment.
Okay.
I feel they're going to possibly help with your stress and anxiety and just coping. Okay. I like to try to focus on your senses: touch, taste, sight, sound, and smell. Just our 5 basic senses. And I'm hoping it will heighten your current awareness, keep you in the moment, just help you with your daily coping skills.
Okay.
Okay. So one of these ways is for you to just go outside, just watch the clouds, go for a walk. And while you're walking, look at the trees. Just be aware of your surroundings. Be aware of awareness.
Okay.
It's a mindful technique, and I think it will keep you grounded and get you more present.
Okay.
And help you
Being
with
in
your coping.
nature.
Being in nature. And the second thing I would like you to do is keep a daily journal.
Okay.
Now, in this journal, I would like you to write your experiences of staying present.
Okay.
You know, when you're out in nature, how did that make you feel? When you're looking at the clouds, what did you see? What did you feel when the wind was hitting your face? And just your thoughts and feelings that transpired throughout the day.
Okay.
And I want you to remember that this is your journal, and you write down what you feel and what your thoughts are.
Okay.
Just and you can just write about anything that comes to mind.
Okay. Not just specifically
No,
than being outside, but other
no,
things that
whatever
are
comes to your
Okay.
mind. But I'd like you specifically to write down when you're outside, the thoughts and feelings you'll have then.
Okay.
And then write down how you feel when, in regards to the other family members. What do you feel at that time?
Yeah. Okay. That's very possible. I can do that.
Okay. And then make sure you bring your journal to your next session.
Okay.
And just I want to make sure you can be committed to your mindfulness activities and your journal, your daily journal. It's important.
I can. I don't mind writing anyway. And I do a lot of writing for work, so it's not a difficult task. I can do it.
Great. The next questions I have are just general basic information, such as your age.
Okay. My age. I'm 55.
The question everyone likes.
Yeah.
Okay, and your marital status?
I'm married.
Okay. And do you live with your significant other?
Yes.
Okay. And children? Do you have
Two
children? And can you give me their ages?
Oh, they're grown and gone. So, they are 22 and 25.
Okay. All right. right, we're going to move along. We're going to talk about medical conditions in history.
Okay.
And you might be asking, like, what does my medical health have to do with my mental
health.
health?
Okay.
And medical health does have a major impact on mental health. And I'll give you an example. Someone may feel discouraged and depressed after they received a medical diagnosis, or if they're in chronic pain. So the two do impact each other. Okay. So, all right. Do you have any conditions that would cause you to, like lack of sleep, stomach pain, loss of appetite?
So I do sleep fine. I don't have a problem with that, but I do have a lot of stomach pain.
Stomach pain. And can you tell me a little bit more about that?
Well, it really increases during stressful situations. You know, I can just feel that I'm very tense, and then I might have some pain when I eat or anything. You know, so I try not to eat a lot.
Okay, so the pain increases
when the stress increases.
When the stress increases. Okay. Okay. Have you ever mentioned this to your physician?
Yes.
Okay. Did he prescribe any medications?
Well, not anything, you know, over the counter antacids, but he really felt I should just talk to someone more than have medication.
And I agree. We'll try this, and hopefully this will be the help you need. I'm feeling hopeful.
Okay.
Yes, I'm very encouraged and very hopeful. Okay. So now we're going to move on to some of your mental health concerns in history.
Okay.
You've talked about the anxiety, and you've also talked about the stress of dealing with family members. Can you tell me a little bit more about the family members? Specifically, who are the family members?
Oh, so it's actually my parents. They're aging, and I mean, my kids are fine. My husband is supportive, but so my father cannot hear very well, and it's very difficult. He does have hearing aids, but it's still difficult. And my mother is his primary caregiver, and she is very frustrated, and she is almost abusive towards him out of frustration.
Okay.
So it is very difficult to deal with her at times. And so I am hoping to, number one, you know, get rid of some of my anxious and then traits, and then have some concrete ways to deal with someone who can be irrational.
All right. Sounds like we have a few things to work on. Yeah. First, I think we should just work with you and see if we can get that anxiety down.
Okay.
Do you feel isolated?
No, I don't. And I make a point to go out and see friends, because I know that isolation is not a good thing, especially when I'm feeling this way. So I do try to, you know, I go to work, I try to do things with friends. So
sounds like you have a support system through friends.
I think so, yeah.
And work.
Right.
Your colleagues at work. Okay. Have you lost interest in your usual activities?
To some degree, yeah, because by the end of the day, I just feel like, what's the point? You know, I'm just too tired mentally to like go for a walk. So I find myself at home just sitting and maybe watching mindless TV or scrolling through my phone, which are not productive. I don't think.
I heard you say, what's the point? Can you give me a little more information
of exercising? I mean, or you know, I'm just spent.
You spend at the end of the day.
So I don't really do anything for myself. I might eat junk food and sit in a chair. And that's not really good for
So
you.
it sounds like your physical health, maybe, the going outside, going
Right.
for a walk.
Declined.
Yeah. You're not getting what you need physically and mentally.
Correct.
Correct. Okay. Do you feel like we've missed anything?
No, I don't. No, I think you've been pretty thorough.
Okay. Thank you for sharing your answers. We still have a lot more to go.
Okay.
I'm gonna next ask you more personal information, and if you need to take a break, that's fine.
I'm okay. Let's keep going.
All right. So the next thing I'd like to move on to is your family history.
Okay.
And you've stated already that you have you're married, and you live with your significant other.
Yes.
And you have 2 boys.
Yes.
Who have moved away.
Yes.
All right. Do you still receive communication with your boys?
Yeah.
Are you able to talk to them?
Yes. Well, yeah, we have good communication. I just don't like to burden them with what's going on, because they both have new jobs and they just have their life to live. So I keep them posted, but I wouldn't go into a lot of depth with them.
Okay. And your parents are still alive? And your mom's health has declined?
Yeah. She's lost a ton of weight, and she is very anxious and not always very rational.
Okay. And your dad?
He's he's very physically healthy. He just can't hear what's going on.
So your mom's health is declining, and your father has hearing loss.
Right.
And you come into the middle.
Righto. Yeah.
Okay. Well, it sounds like my next question was concerns about family, and it sounds like you do have lots of concerns about your parents.
Yes. Yeah. I think my father is happy. I'm not sure my mother is happy, but it gets difficult when someone is approaching 80. How do you help them?
Right. So maybe we need to look into added supports for you at your parents' home. Looking into some resources that we could get for your parents.
Okay.
Might help.
Sure.
How about your husband? Is he part of?
Yeah, so he's very supportive. He helps. He listens, and he's just not around a lot because he has a job that takes him away every week.
Whoops, excuse me.
Yeah, no, he's just gone. He's home on the weekends only.
So you have a supportive husband,
right?
But his job takes him away,
right? So he's mentally supportive, but he is physically absent.
Okay, I've got a little more information. The next questions I need to ask you might be a little difficult for you. It's information regarding mental and psychological disorders within your family.
Okay.
Do you know of any of those? It can be aunts, uncles, your parents.
So my mother's sister definitely has some issues, but she has not been clinically diagnosed.
Okay.
But she's alienated everyone in the family. So, I don't know. There is a lot of suspicion about mental health, but I don't know that anyone has been diagnosed.
No diagnosed. Okay. Anyone else in your family?
No.
Okay. Okay. I would like to get some background information about your childhood.
Okay.
All right. Who raised you?
Both of my parents.
Both your parents?
Yeah.
Okay. Can you just close your eyes and describe what a perfect childhood would look like to you. Just take a moment and just visualize that perfect childhood.
Mm, I think there would be a feeling of safety and security and a clean home and maybe a good place to be outdoors in nature.
Okay.
Yeah.
So nature would be important as a
Mhm.
child, cleanliness.
Right.
How would you picture your parents being? Would they
Patient.
patient?
Yeah, patient.
So you see your parents very
Patient and calm.
and calm. Okay. I'd like to ask you, do you belong into any social groups or organizations?
Do you mean I do some volunteer work
Yes.
for the local literacy volunteers? So I do that.
Great. That sounds great. You stated that your parents are still alive. Have there been any like major loss in your life or major events? Loss like a loss of a sibling or any close member?
No, well, no, I have to say I am an only child, so I don't have siblings, but I really do in times like this wish that I had siblings. Um, and no, I have lost my grandparents, but as of yet, I have not experienced a significant loss.
So you've stated that you're an only child and you have parents that are declining in health. You're currently not receiving any outside services for your parents.
Right.
Okay. And this is causing a lot of frustration maybe for you.
Yeah.
Agitation, you're anxious. Okay.
Yeah. Yeah.
And you have no support as far as other family members.
Right.
You can talk to your husband.
Right, but he's absent physically. My children have moved away, so I'm really the only one dealing with this. And my parents are very isolated also. They don't have a great circle of friends or so there really are limited resources on how to deal with these two.
Okay. So I do again feel that we need to look into those outside sources.
Okay.
I think that would be important. Do you have any religious preferences or spiritual preferences? How about any personal preferences? Like, is the space here good between you and I? Are you comfortable with this room, this area?
No, it's all fine.
Okay. All right. It's very important that you feel comfortable so we can make accommodations so you are.
Okay. No, yes, I'm fine.
Okay.
It's all good.
All right, let's move on to education.
Okay.
All right. Can I ask you your level of education?
I have a master's.
And can I ask you, what is your master's degree
Education.
in? Education. Okay. What schools have you attended?
I did most of my work in the University of Maine system.
Okay. Were you satisfied with your schooling?
Yes.
Good. Has teaching or education always been your passion?
Yes. Off and on through life. Yes. I mean, I've taken different roads and ended up in different positions, but overall, yeah, that was my main goal.
Okay. And you're satisfied with your current
I
position,
am.
education?
Yes.
Great. Okay, which brings us to your work history.
Okay.
Okay. Your current employment status.
I am employed.
Okay. And your job title?
teacher,
Teacher.
instructor. Hmm.
And you're how satisfied are you with your job?
Very.
Good.
Yeah.
So your job is not adding any additional stress or
No, not really. I mean, there are days where, things get interesting and it could be a little stressful, but overall, no, I'm very happy with
all
my job.
right. So we're back to just dealing with you and your personal goals and
Yep.
see if we can get things better at home for you. Have you ever had any legal implications?
No. Mm-mm.
Good. Um, what do you see as your personal strengths? Um, you've stated that you have education.
Mm-hmm. Uh, I, oh gosh. I would like to think that I am kind or empathetic. Um, I do feel like I might be at the end of my rope there, or, I just need a few more skills, but, um, yeah, I think, is that what you meant?
Yes.
Okay.
Yeah. Do you feel that anything that's happening with your home is reflecting back into your job?
No.
No. Perfect.
No.
Yes.
No, I don't think so. I do feel a little more tired some days or a bit unsettled because I can't quite get a grip on what's happening, but I do really try to focus on work and put that aside. So,
So you're able to leave, as the saying goes, home life is home
yeah,
and work is work.
yep, it
Okay.
is.
All
I
right.
actually find solace in work, so I'm happy to go to work because it means I can't deal with anything else.
So you're using work right now to
To
avoid
avoid
the
other
home
things.
life.
Yes.
Yes. And it's not even your personal home life, it's
No.
more the home life your parents.
Right.
With your parents.
Right.
Okay. Do you feel that there's any challenges that would prevent you from coming to your weekly sessions? Transportation?
No. The only if there was a big emergency with care with my extended family, that may prevent me, but otherwise, no.
Okay. So you feel that you could definitely come to weekly?
Yes.
Okay. And you would make sure that it didn't interfere with your parents. It
Right.
would be you'd be able to do it.
Yep.
All right. Do you have any other questions for me?
No.
All right. If you could please practice your mindful techniques that we talked about.
Okay.
Remember your 5 senses and use them to help heighten your awareness of the current moment.
Okay.
Stay present. Focus on going outside. What do you see? What do you hear? The breeze on your face. Just take that time for yourself.
Okay.
And just stay present.
That actually will give me an excuse to do it.
Yes.
If it is assigned and I have to do it, I'll do it.
And then I would like you to just keep your daily journal.
Okay.
And just write your experiences with staying present, the mindfulness exercises, and just your thoughts, feelings. Remember, it's your journal, your thoughts, your feelings. I want you to just try to reflect on the day. Just anything that comes into your mind. And I want to thank you for today.
Oh, thank you.
No, we went over a lot of questions. Some of them were very difficult, but it's necessary for me to be able to help you to know this information. And I look forward to seeing you next week.
Okay, thank you.
Thank
I look
you.
forward to it as well.